Brielle Maddox, step away from the medication cabinet.
I helped patients through dialysis shifts. I was not trying
Nurses
to hurt
reported pain that did not match what the log said was given.
Brielle Maddox worked in that dialysis clinic for months without a single supervisor checking the waste log she signed every shift. Dozens of patients in that chair were depending on her. Not one person checked.
Dialysis days are long. Patients feel pain for a lot of reasons.
The audit found medication pulled but never reaching the patient.
You are turning a clinic full of sick people into proof I planned every gap.
She would not get the chance to explain. Within 72 hours, federal investigators would seize the controlled substance logs, the pharmacy reconciliation reports, and a thumb drive containing 11 months of falsified waste entries. 23 patients, $186,000 in diverted medication, and the smoking gun, a single waste log signed off in her own handwriting that read, 100% discarded for a 4 milligram dose of hydromorphone that pharmacy records showed had been pulled from the clinic safe, but never reached the patient at all. The people in those chairs trusted her with their lives 3 times a week. She left them hurting so the doses could go somewhere else. I need you to stick around for this one. The victims in this case had no choice but to sit in that chair 3 days a week just to stay alive. And what was done to them while they sat there is hard to hear. If this case makes you angry, put that in the comments. Subscribe if you believe medical professionals should be held accountable. These stories don't get the coverage they deserve. Brielle Renee Maddox was born on April 9, 1991, at Foote Hospital in Jackson, Michigan. Her father, Carl Maddox, worked the second shift on the assembly line at the General Motors Lansing Grand River plant for 31 years. Her mother, Lorraine, served lunch in the cafeteria at Northwest Elementary School. They lived in a 2-story rental on Cooper Street, then bought a small ranch house in Vandercook Lake when Brielle was 7. She had one older brother, Trent, who joined the Army National Guard at 19 and never moved back home. The defining moment of Brielle's childhood happened in the summer of 2001. She was 10 years old. Her maternal grandmother, Marjorie Pelletier, had been diagnosed with end-stage renal disease the year before, and Lorraine started bringing Brielle along to the dialysis appointments at Sparrow Outpatient Center in Lansing. 3 times a week, for 4 hours at a stretch, Brielle sat next to her grandmother's recliner. She watched the technicians cannulate the fistula in Marjorie's left arm. She watched the blood leave the body, run through the dialyzer, and come back warm. She watched the nurses adjust pump speeds and check blood pressures and ask her grandmother how she was feeling. She thought it was the most important work in the world. Marjorie died in February of 2003. Brielle was 11. She told her 6th grade career day teacher she was going to be a dialysis nurse. She kept that ambition through Vandercook Lake Junior-Senior High School, where she graduated in 2009 with a 3.4 GPA and a yearbook quote about helping the people no one else has patience for. Her guidance counselor's evaluation called her warm, attentive, and unusually patient with elderly residents during her senior year volunteer placement at Crestwood Manor Nursing Home. She enrolled at Jackson Community College in the fall of 2009. The full nursing program was a 4-year commitment, and her family did not have the savings. She enrolled instead in the 18-month Certified Nursing Assistant track. She graduated in March of 2011, passed her state CNA exam on the first attempt, and accepted a position at Crestwood Manor at $9.40 an hour. She worked there for 3.5 years on the dementia ward, picking up double shifts, sleeping in her Ford Focus between rotations. In 2014, she enrolled in the Patient Care Technician Certification Program at Lansing Community College. 6 months of coursework, 200 clinical hours, and a national board exam administered by the Board of Nephrology Examiners. She passed with a score of 84 and earned her CCHT credential, Certified Clinical Hemodialysis Technician, in November of 2014. Her first dialysis job was at a 4-chair satellite clinic south of Lansing. She worked there for 2 years before applying to Riverbend Outpatient Dialysis on Pennsylvania Avenue in Lansing, a larger 60-chair facility owned by a regional health system. She was hired in May of 2017 at $19.20 an hour. Her interview notes from charge nurse Renee Calderwood, who would become her direct supervisor for the next 7 years, read, "Solid clinical knowledge, confident with cannulation, patient-focused, comes from a dialysis family, strong fit." Her first 3 performance reviews at Riverbend were uniformly positive. Consistently meets expectations. Builds rapport easily with patients on long protocols. Reliable witness for medication waste documentation. Recommended for charge tech consideration in 2022. She picked up extra weekend shifts. She covered for co-workers when their kids were sick. She remembered her patients' grandchildren by name. Then, in October of 2019, she was helping a 280-pound transfer patient from a wheelchair into chair 14 when she felt something tear in her lower back. She filed a workers' compensation claim. An MRI at McLaren Greater Lansing showed an L4 to L5 disc herniation. Her family doctor prescribed a 30-day course of hydrocodone acetaminophen, 5/325. The prescription was refilled twice. By February of 2020, the prescription stopped. The pain did not. Brielle Maddox did not tell anyone at Riverbend. She kept working. She kept smiling. And she kept walking past the controlled substance cabinet every single shift, 3 times a day, for the next 3 years. Riverbend Outpatient Dialysis Center is a 60-chair facility occupying the 2nd floor of a medical office building on Pennsylvania Avenue in Lansing, Michigan. The clinic runs 3 patient shifts per day, 6 days a week. First shift starts at 5 a.m. Last shift ends at 10:30 p.m. On a typical Monday, Wednesday, or Friday, the clinic treats 182 unique patients. The average treatment lasts 3 hours and 45 minutes. The chairs are arranged in 3 pods of 20, separated by glass partitions. Each pod is staffed by 1 registered nurse and 3 to 4 patient care technicians per shift. The PCTs do the hands-on work. They prepare the dialyzer. They cannulate the fistula. They monitor vital signs every 30 minutes. They troubleshoot alarms. They sit with the patients. They are the ones the patients see most. Controlled medications at Riverbend are stored in an Omnicell automated dispensing cabinet on the wall of the medication room behind the nursing station. The cabinet requires a fingerprint scan and a 4-digit PIN. Every withdrawal is logged. Every withdrawal requires a patient name, a physician order, and a witnessed waste documentation if any portion of the dose is not administered. The clinic stocks hydromorphone, fentanyl citrate, midazolam, lorazepam, and morphine sulfate, primarily for breakthrough pain, severe restless leg syndrome, and sedation during difficult cannulations. The regulatory framework is layered. The Federal Drug Enforcement Administration requires controlled substance dispensing records under 21 CFR, Part 1304. The Michigan Department of Licensing and Regulatory Affairs requires monthly reconciliation between pharmacy delivery records and dispensing cabinet withdrawal logs. The clinic's own Quality Assurance Committee was supposed to audit a random 10% sample of waste logs every quarter. The vulnerability sat in plain sight. The witnessed waste requirement assumed 2 licensed staff members were physically present at the moment of disposal. In practice, during the chaos of the 5 a.m. shift change, patients arriving, machines being prepped, alarms going off, witnesses signed waste logs after the fact. A trusted long-tenured tech could pull a dose, document it as patient comfort administered, then later return to the cabinet, pull a second vial, document a partial waste, and walk out with the remainder. The waste log would say 1 milliliter discarded into sharps. A nurse on the way to a patient bell would sign as witness without ever seeing the syringe. The patients themselves were the other vulnerability. Dialysis patients are chronically ill. Most are elderly. Many have neuropathy that produces baseline pain. Many have cognitive issues that worsen as their treatment progresses through the 3rd and 4th hours. When a patient reports that the pain medication didn't really do anything today, the standard response is to consider tolerance, anxiety, or the patient's underlying condition. Almost never is the response, "Someone on this floor stole the dose." The trust that ran the room was the same trust that hid the theft. The first diversion happened on November 4th, 2022, at 7:18 a.m. Riverbend had received a Monday morning shipment of hydromorphone 2 mg per milliliter vials. Patient Walter Strain, 66 years old, end-stage renal disease secondary to type 2 diabetes, on dialysis since August of 2019, had a standing order for 1 mg of hydromorphone IV push for breakthrough pain during the first hour of his Monday and Friday treatments. He was in chair 7. Brielle Maddox was assigned to him that morning. She pulled the vial from the Omnicell at 7:14 a.m. She administered the full dose at 7:18 a.m. She documented it. Walter Strain went to sleep, as he always did, for the next 2 hours. At 9:42 a.m., she pulled a second vial of hydromorphone from the cabinet under the name of patient Helen Mosley in chair 12, who had a PRN order on file but had not requested medication that day. Brielle documented in the EMAR. Patient declined. Dose wasted per policy. She walked to the Sharps disposal. She walked past it. She walked into the staff bathroom. She closed the door. That was the template. Over the next 11 months, Brielle Maddox would refine and escalate it. The first method was the false waste log. She pulled medication under the name of a patient with a PRN order who had not requested it. She documented it as patient declined or wasted per protocol. She kept the full vial. She found a tech she trusted who was running between 2 chairs and asked them to sign as a waste witness. They signed without looking. The second method was partial diversion. She pulled a 2 mg vial for a patient with a 1 mg order. She documented administering 1 mg and wasting 1 mg. She actually administered the full 2 mg minus the dose she kept, which was usually 1.2 to 1.4 milligrams. The patient still got something. The patient still slept. The patient still rated the pain relief as adequate on the post-treatment survey. The third method was tampering. Beginning in March of 2023, when she had run her own personal supply down to nothing on a Sunday evening, she came in early on Monday morning, pulled a 2 mg hydromorphone vial, drew 1.5 milliliters out with a syringe, replaced the volume with sterile saline from a 10 milliliter flush, recapped the vial with a hub from the supply room, and returned it to the cabinet. Walter Strain received that vial at 7:23 a.m. His effective dose was approximately 0.5 milligrams. He woke up 40 minutes into his treatment in significant pain. He told the nurse. The nurse offered ibuprofen. He declined. He completed the treatment and went home. The pattern escalated through the spring and summer of 2023. By June, Brielle was diverting on every shift she worked. By August, she was tampering with vials on average twice a week. By October, she had identified the patients least likely to complain: the heavily sedated, the cognitively impaired, the elderly, the ones who arrived alone and left alone. She kept her own private notebook in the glove box of her 2014 Honda Civic. Not patient names, just initials and chair numbers and a column marked Y or N for whether they had reported pain. The lifestyle changes were invisible. She did not buy a new car. She did not take vacations. She did not gamble or shop. Her bank account stayed in the low 4 figures. She lived in the same 1-bedroom apartment at the Westview complex she had rented since 2018. She paid rent. She paid her student loans. She drove to work. She drove home. She ate alone. What she did with the diverted medication was not glamorous. She injected hydromorphone in her car in the Riverbend parking garage between shifts. She injected fentanyl citrate in the staff bathroom on Saturday mornings. She made it through her shifts. She charted accurately for every patient who actually received a full dose. She remembered birthdays. She helped a coworker move into a new apartment in July. She covered 3 weekend shifts in August so another tech could attend her daughter's wedding. The chronicity of her own dependence was clinically severe. She knew it. She had never told anyone. She would later tell investigators she had searched the phrase "how to detox from fentanyl at home" 43 times between January and October of 2023. No one at Riverbend noticed. No one checked. The unraveling began with a complaint about pain. Walter Strain, the same Walter Strain who had been Brielle's first diversion patient on November 4, 2022, was a 68-year-old retired plumber from Holt who had been on dialysis for 4 years. He was a quiet man. He read paperback westerns during his treatments. He almost never complained about anything. On the morning of October 9, 2023, he told his charge nurse, Renee Calderwood, that the pain medication he had been receiving for the past several months wasn't doing anything anymore. He said it gently. He said maybe he was getting used to it. Renee Calderwood had been a charge nurse at Riverbend for 14 years. She had heard the medication didn't work 1,000 times. The standard answer was tolerance, anxiety, the patient's underlying disease state. She told Walter she would mention it to the medical director and they would consider adjusting the dose. She finished the shift. She went home. She did not think about it again that night. 3 days later, on October 12th, a patient named Helen Mosley, 71, chair 12, on dialysis for 2 years, said almost the same thing. "Honey, that medication they gave me today, it didn't touch me." Helen was on a different medication and a different dose. The complaint should not have correlated. But Renee Calderwood had been a nurse long enough to feel something prickle. She started keeping a private list on a yellow legal pad in her locker. Patient name, date, medication, dose documented, patient's subjective relief, tech who administered. By October 24th, the list had 11 patients on it. 8 of them had been treated by the same patient care technician. That patient care technician was Brielle Maddox. Renee did not confront Brielle. She did not say anything to the other techs. She walked into the office of the clinic medical director, Dr. Yasmin Patel, on the afternoon of October 24th, closed the door, and laid the yellow legal pad on the desk. Dr. Patel called the pharmacy director, Dr. Aaron Fenwick, that evening. By the next morning, a full reconciliation audit had been initiated under the cover of a routine quarterly inventory. It was anything but routine. The audit covered the prior 6 months, May through October of 2023. The pharmacy reconciliation matched controlled substance shipments received from the regional distributor against withdrawals logged in the Omnicell against documented patient administration in the electronic medication record. Within 48 hours, the picture was clear. There was a gap. The gap was not random. The gap correlated with shifts worked by a single staff member. Dr. Fenwick called the Regional Health Systems Compliance Officer on October 27th. The compliance officer called the DEA Detroit Field Office on October 30th. We're heading into the federal investigation now. If you've made it this far, you already know how serious this gets. Subscribe so you don't miss the moment she's confronted on her own clinic floor. We cover cases the mainstream press never touches. The investigation was led by Drug Enforcement Administration Special Agent Marisol Quintero out of the Detroit Field Office, with assistance from Detective Eli Brackett of the Lansing Police Department's Drug Diversion Unit. It opened officially on November 1st, 2023, under file number 23-DEA-DET-1188. The first step was a comprehensive pull of every Omnicell withdrawal Brielle Maddox had executed between January 1st, 2023 and October 31st, 2023. 3,491 withdrawals. Each was matched against the EMAR documentation, against the waste log signatures, and against the nursing notes for the corresponding patient encounter. The discrepancies were not subtle. 47 controlled substance vials had been withdrawn under the names of patients who had no documented administration record. Each one was logged as wasted per protocol. In 31 of those cases, the witness signature belonged to a nurse who later confirmed in interviews that she had signed during shift handoff without observing the actual disposal. But the smoking gun was the single waste log entry from November 18th, 2022, at 9:42 a.m. vial 7-4-4913. Hydromorphone 4 milligrams in 2 milliliters. Pulled under the name of patient Helen Mosley. Documented in the EMAR. Patient declined, full dose wasted per policy. Witness, J. Kowalski, PRN. Signed by Brielle Maddox, 100% discarded in sharps. Helen Mosley had never had a 4 milligram PRN order in her chart. Her standing order was 1 milligram. The pharmacy stocking record for that morning confirmed that a 4 milligram vial had been pulled from the cabinet. Sharps disposal protocols required photographic documentation of any waste above 2 milligrams. There was no photograph. The vial had not gone into the Sharps container. Helen Mosley never received any dose. The 4 milligram dose had simply vanished, signed off in Brielle's own handwriting as 100% discarded. The medication room security camera footage was pulled next. The clinic had a single ceiling-mounted camera installed in 2018 that recorded continuously on a 30-day loop. The DEA obtained a preservation order on October 30th. Quintero and Brackett spent 3 weekends in November watching footage. Brielle Maddox appeared on camera 114 times accessing the controlled substance cabinet. In 38 of those instances, she did not proceed directly to a patient chair. In 9 instances, she entered the staff bathroom within 60 seconds of leaving the medication room. Tampered vials were sent to the Michigan State Police Toxicology Laboratory. Of 23 vials pulled from the cabinet stock for testing on November 14th, 11 returned results inconsistent with the labeled concentration. The contents had been partially withdrawn and replaced with sterile saline. The dilution was variable. Some vials contained less than 30% of the labeled hydromorphone concentration. Patient interviews ran from November 20th through December 8th. 23 patients were identified as having received tampered or short-dosed medication during the audit period. 4 of them had medical records documenting unrelieved breakthrough pain consistent with underdosing. One patient, Curtis Vines, 54 years old, suffering from post-amputation phantom limb pain, had specifically requested that his standing dose be increased because the dialysis pain meds had stopped helping him at all. The investigators also pulled Brielle's personal cell phone records under a federal search warrant signed by United States Magistrate Judge Ann Brennan on December 12th. The phone itself was not yet in their possession. They subpoenaed the search history through her cellular carrier. The results were comprehensive. Between January 1st and October 31st of 2023, she had searched for how long until hydromorphone shows up in urine 56 times. Fentanyl half-life IV 41 times. Suboxone clinic Lansing 18 times. How to taper without anyone knowing 11 times. Withdrawal symptoms after 1 week 29 times. There were no text messages to a co-conspirator. There was no buyer. There was no second person to flip. The investigation had identified a closed loop, a single person, diverting for personal use, leaving 23 patients to absorb the consequences. The grand jury voted to indict on February 5th, 2024. The arrest was scheduled for the morning of February 11th, a Sunday. Her shift started at 5 a.m. February 11th, 2024. Lansing, Michigan, 5 degrees Fahrenheit, light snow. Brielle Maddox arrived at the Riverbend Outpatient Dialysis Center at 4:42 a.m. She parked in her usual spot on the 3rd level of the attached parking structure. She carried her insulated lunch bag, her travel coffee mug, and her Riverbend ID badge on a lanyard. She rode the elevator to the 2nd floor. The interior of the clinic at that hour was usually quiet. The night cleaner had just finished. The first patients would arrive at 4:55. Brielle walked through the staff entrance, swiped her badge, and proceeded down the back corridor toward the staff lockers. She did not get there. Renee Calderwood was standing in the corridor. So was Dr. Yasmin Patel. So were 2 people Brielle had never seen before. One was a woman in a dark jacket with a DEA badge clipped to her belt. The other was a man in a gray sport coat with a Lansing PD detective's shield. "Brielle," Renee said, "we need you to come with us." The 4 of them walked her into the small administrative office at the end of the hall. The door closed behind them. Special Agent Quintero introduced herself first. Detective Brackett introduced himself second. Quintero set a manila folder on the desk between them. She opened it. She placed the November 18th waste log on top. Brielle looked at the page. She did not pick it up. Quintero: "Do you recognize this document?" Brielle: "It's a waste log." Quintero: "Whose signature is at the bottom?" Brielle: "Mine." Quintero: "And what does it say?" Brielle: "It says 100% discarded." Quintero: "For what medication?" Brielle: "Hydromorphone." Quintero: "For which patient?" Brielle: "Helen Mosley." Quintero: "Helen Mosley never had a 4 milligram order on file. Do you want to explain that?" There was a long silence. Brielle Maddox lowered her head until her chin was almost touching her chest. She put both hands flat on the desk. She inhaled. She exhaled. Brielle: "I want to make this easier for everybody. I did it." She did not ask for a lawyer for another 19 minutes. In that span, she walked Quintero through the broad outline of the diversion. She named the medications. She admitted to the tampering. She said the word saline. She said the word withdrawal. She said the words, "I am so sorry." Then she said, "I think I need to talk to an attorney." The interview ended. She was placed under arrest. She was walked out the same back corridor she had walked in through 27 minutes earlier. She was processed at the Lansing PD Special Operations Facility. She was held without bond pending arraignment. The 5 a.m. shift started without her. Patient Walter Strain arrived at 4:58 a.m., settled into chair 7, and asked Renee Calderwood where Brielle was. Renee told him she was not coming in. He nodded once. He opened his paperback. He waited for his treatment to begin. The federal grand jury indictment, returned on February 5, 2024, in the United States District Court for the Western District of Michigan, charged Brielle Renee Maddox with 11 counts. 3 counts of obtaining a controlled substance by fraud under 21 U.S.C. Section 843(a)(3), 4 counts of tampering with a consumer product under 18 U.S.C. Section 1365(a), and 4 counts of acquiring a controlled substance by misrepresentation. The state of Michigan filed concurrent state charges for drug diversion and falsifying medical records. Her defense attorney was David Otsuka, a former federal public defender now in private practice on Allegan Street. He was court-appointed after Brielle exhausted the $4,000 in her checking account on a retainer she could not cover. Otsuka filed 2 motions. The first was a motion to suppress the cell phone search history, denied on April 8th. The second was a motion for downward departure at sentencing based on substance use disorder, granted in part. On August 14, 2024, in open court before United States District Judge Patricia Whelan, Brielle Maddox pleaded guilty to all 11 federal counts under a plea agreement that capped her exposure at 60 months. The state charges were resolved separately with concurrent time and surrender of her CCHT license. Sentencing was held on November 19, 2024. The courtroom in the federal courthouse in downtown Grand Rapids was full. 12 dialysis patients from Riverbend, or their family members on their behalf, were present. Walter Strain was the first to deliver a victim impact statement. He was 68 years old. He used a cane. He walked to the lectern slowly. Walter Strain: "I sat in that chair 3 times a week for 4 years. When my back hurt, when the cramps were so bad I couldn't think, she was the one who was supposed to help me. She gave me water instead. She told me to breathe through it. And the whole time she had taken what was supposed to be mine. I'm not angry. I'm tired. I am very, very tired. And I want everyone in this room to understand that the worst part isn't what she took from me. It's that she made me feel like I was the one being weak." Helen Mosley's daughter spoke next. Then Curtis Vines. Then a man whose mother had died in March of 2024, with her pain inadequately managed across her last 6 dialysis sessions. Judge Whelan addressed Brielle directly before pronouncing sentence. Judge Whelan: "Ms. Maddox, I want to be very specific about what makes this case different. You did not steal money. You stole the only relief that the most chronically ill people in your community had access to. You sat next to them, you held their hands, you called them by name, and you took from the people most physically dependent on you the medicine they were prescribed for the suffering they could not otherwise escape. You did this for almost a year, and you did it deliberately, and you did it knowing every patient you walked away from would absorb the cost of your dependence. I understand that you are sick. I understand that addiction is a disease. But this court must mark, in this sentence, the difference between a person who suffers from addiction and a person who uses their position of medical trust to harm the patients in their direct care. That difference is what I am sentencing today. The sentence was 60 months in the custody of the Bureau of Prisons, followed by 3 years of supervised release with mandatory inpatient substance use disorder treatment as a condition of release. Restitution was ordered in the amount of $186,400, payable to the Riverbend Regional Health System and to the 11 patients with documented medical claims. Her CCHT license was permanently revoked. Her CNA license was permanently revoked. She was barred for life from employment in any DEA-registered facility. She was remanded to custody immediately. She was transported to the federal prison camp at Alderson, West Virginia, a minimum security women's facility, on December 4, 2024. Her projected release date, accounting for good time credit, is February 11, 2029, 5 years to the day from her arrest. Riverbend Outpatient Dialysis Center remains open. A new charge nurse oversees medication waste documentation. Every controlled substance waste is now witnessed in person by 2 licensed staff, photographed at the moment of disposal, and signed in real time. The Omnicell has been replaced with a newer model that requires both fingerprint and iris scan. Patient pain relief surveys are now reviewed by the medical director monthly. Walter Strain still comes in every Monday, Wednesday, and Friday. He sits in chair 7. He reads his paperback. The new technician's name is Anna. She knows his grandkids by name. This case was hard to sit with, but the next case on your screen right now goes somewhere even darker. Click it now.